hi everyone. Thank you, Seth. Thank you, Lauren. Thank you, HFC, for your leadership, for your example, your energy, for all the great work that you're doing for Alzheimer's and caregiving. And congrats on the very first CareCon. I'm Leeza Gibbons. I'm the daughter of a mom and a grandmom with Alzheimer's. And when my mom got sick, like with many of you, you know how it changes everything. And so I took what I thought was a hiatus from TV hosting to figure out, what do I do now? What's my seat at this table? So that was in 2002. And since then, I created Leeza's Care Connection to offer tips and tools and strategies to help families like mine. So this has become a very important part of my identity. And I couldn't be more proud to be in the company of the other moderators today, these spectacular panelists. Thank you to Kimberly and Ashley for her great panel that happened, their panel that happened before. I am especially excited about my fabulous panel. Welcome to each of you. I know they're going to provide a lot of insight for you, a lot of advice, a lot of support, and a real sense of community that hopefully will help us figure out this caregiving challenge and make us feel stronger because of it. So thank you all for being such a resource today. If you are a caregiver watching us, we are your people. So I'm going to look at three things with these fabulous guests. One, what it's like. Two, what you can do. And three, why it's urgent to get help. So hi, everybody. Dr. Olson, I'd like to start with you, if I may. I think that caregivers are probably among the most amazing problem solvers of all time. So let's look at the positives based on your work. Can you share what you found to be the skills that caregivers have that we can all learn from?
Hi, Leeza. Thank you for having me. I think that the key skills are around logistics. You think of a caregiver who's handling medication schedules, food schedules, doctor's appointments, making sure that every bit of household and life elements are taken care of. That's an incredible amount of work that has to be coordinated. And then the second major skill that I think caregivers are really amazing at is paperwork, insurance, coordination. I think it's the thing that we all dread, but if I were to hire somebody on a team, I'd go to look for somebody who has caregiving experience because they've tackled the most challenging things and often under grace and gratitude, with an approach of grace and gratitude. So we can all learn from caregivers.
Good one. And I don't know if you got a proper introduction. Can you just tell us a little bit about your work? Your career is like massive. About the focus of your career right now.
Sure. I'm currently the CEO of the Rosalind Carter Institute for Caregivers. If you watched during the intermission, Mrs. Carter has been an advocate for caregiving for nearly 80 years when she first had a caregiving experience in her story, in her family's story. So she and I work together along with a team based in Georgia to support caregivers' health and well-being. And before this, I was in public health doing epidemiology. So if there was ever a time to have a public health and caregiving convergence, this is the time for us. And so that's why I'm so excited to be here at a time when people are experiencing COVID isolation and caregivers need our help more than ever.
More than ever. And I do want us to spend more time talking about that later on. And your work and your organization has been so important. Thank you. I want to turn to Dr. Katak right now because we all know every journey is unique, but I do think there's some universal truths. Can we talk about what you see in your work that's really hopeful as caregivers find connection with each other?
Thank you so much. It's such a great honor to be here today. And I think that most of my life has been spent in the field of gerontology and caregiving, but I am also a caregiver for the last 35 years, long distance with my parents and then with my in-laws who live with us. So I think that what is hopeful today, which is so wonderful, is that in the clinical settings, we are recognizing caregivers as being a critical part of patient care. So for example, especially in the field of dementia, if you look at that and what Dr. Olson just mentioned, there are multiple aspects of care, whether it's just the medication, the day-to-day management, health navigation, and we are recognizing the caregiver as being an integral part of this. So that's hopeful that the caregiver should become part of the medical record so that their physicians can reach out to them. That's a very hopeful sign. The other is that focus on caregiver health, self-care. I mean, I cannot tell you how many times I start my consult by asking, where are you in this journey? What is happening to you? What is on your plate? Are you able to take care of yourself? Finding that network of care, finding the support. So we are at a very good time. And finally, I'm part of several national entities that are doing a lot of work in this field, where it's still slow translation to the community, but a lot of work is happening.
You know, I appreciate all the points that you just made, and I wonder if people joining us today can relate to what you said, which is awareness of self. First of all, the voice for the caregiver being so important. Those are the optics. That's the frontline worker who is often not being considered in all these, in the science, in the decision-making, in the psychosocial piece of it. But when you ask a caregiver, how are you? Typically the response will be, well, she's doing okay today, or he fell and, you know, he's having a hard time. And coming to that first person is really hard. So thank you for those points. Our guests today on this panel, who are members of the HFC support group, really excited to hear your points of view. Carlos, can we start with you and talk about some of the stressors? Let's start with really, what was the thing that prompted you to first seek support anyway?
Hello, happy National Caregiver Day. I'm Carlos, I'm from Sacramento, California. And what prompted me is, I guess we have to go all the way back to the beginning when I started this journey. I received a phone call from my dad's dentist. I was the emergency contact for my dad. They called and said, we have some concerns. Sorry. So we have some concerns about your dad. And then from there, the journey progressed. We went to a primary care physician. He was diagnosed with mild cognitive impairment. We didn't receive too much information after that. It wasn't until I kind of read up and researched and advocated to see a neurologist. I told the primary care physician, let's refer him to a neurologist. It was there where I received the diagnosis of dementia, Alzheimer's, and we were directed to a social worker. The social worker gave us some paperwork and some resources, and I reviewed it and I denied it. And then
Denied it, just didn't want to know.
I resisted seeking. And it was one night where I went to a friend's house, we had a couple beers, and I was trying to relax, but I was angry. I was pissed. I hated Alzheimer's. And it was hard to differentiate hating Alzheimer's and my dad at the same time.
Wow.
I was
wow.
And I had some experience with dementia. I mean, not dementia, depression. And I felt myself really sinking deeper and deeper. It was in the middle of the night after coming home and trying to really release what I was feeling, where I ended up calling the Alzheimer's Association and getting them, getting some information from them, and then getting into a support group. And then from there, I evolved into multiple support groups.
I love this story. I love your candor. I love coming face to face with the thief and saying, this really sucks. I am mad as hell, right? And I know everyone here has been there. When I was on my journey of caring for my mom, my grandmom, it's so isolating, as we know. I felt like nobody got it. So in addition to being physically and mentally exhausted all the time, I just felt really misunderstood, which I know all of you can relate to. Rachel, let me toss this one to you. I think you probably get that as well as anyone. You've been through hell and back caring for your mom. At what point did you say, either I just don't know if I can do it, or I know I can't do it alone?
Hi, everyone. Thanks for having me. My name is Rachel Norris. I grew up in Virginia and moved to Pittsburgh. So when I was 21, I graduated from school in Pittsburgh, very excited to start the new journey in my life. And 1 month later, my dad died, and it was super sudden. Took me totally off guard. No one was expecting it. So I went home to spend some time with my mom, and I quickly realized that the memory problems that my mom had been having, that my parents had very lightly talked to me about, had progressed to a point that I was completely unaware of. And I took her to her doctor, who happened to be a neurologist, and she was diagnosed with Alzheimer's. So I went from being completely unaware that there was really anything wrong to being an only child caregiver for my mother, who had early onset Alzheimer's.
Wow.
So I started by looking for help as far as what to do. I didn't even know what Alzheimer's was. So I just kind of collected information here and there. My parents are part of a great church community. So there were some folks that came forward to help me, which was great because I really
Nice.
didn't know where to start. So once I kind of established my footing and kind of got into the world of Alzheimer's, I looked for things like the Alzheimer's Association, and I looked for help for my mom. So I kind of created my to-do list of, how can I help my mom? What can I do to help my mom? So once I got my mom to Pennsylvania and I had her settled here, then I kind of realized, well, I'm kind of done with my to-do list. So how do I help her now? And then I realized that I needed to help myself.
Yeah,
So
that's the big aha moment, isn't it? Oh, what
Yeah.
about me?
Yeah, exactly. So that's when I kind of turned and started reaching out and trying to find a support group. And I was so happy to find HFC, because it's very difficult as a young person to be part of a group where everyone is a significant amount older than you, because it's just such a different life experience and
Yeah.
such a different part of your life. And I'm super lucky to be part of a group where it's all women taking care of their mothers. So we're able to connect with each other in such a special way. And I'm just so grateful for the opportunity to be working with HFC and to be part of a group that helps you care for your person, but also helps you care for yourself.
Which is so important, because what we know is that typically better care for caregivers translates to better outcomes for care receivers, for everyone. It's just so counterintuitive many times for us to put that focus on ourselves, because we have what my friend calls fog, fear, obligation, guilt, right? And caregivers were in that fog so much of the time. Monique, let me ask you about your challenge and your ultimate choice to get support. I mean, can you tell us how it affected your day-to-day caregiving? We can't hear you. There you go.
Yay.
Yay.
No, hi, I'm Monique, and I am here in Atlanta. But my mom lived in Florida for years and was experiencing all kinds of memory issues that I didn't know about until I had graduated from graduate school, and we were having a conversation, and she just started talking about how, she was saying the same thing over and over again is the first thing. And so then I started saying, okay, wait a minute, I've got to get back to Florida, check on her, see what's going on. And then I started noticing that she was doing certain things. She was paying the mortgage twice. She was, all of those things were going on. And without any warning whatsoever, we were placed in this situation. Well, I have a sister, but I'm the only one really doing, and it kind of happens like that in family sometimes. And so I realized that I was going to have to do some heavy lifting on her side. But even after all of that, because that took years, I realized that about 10 years ago, and then I just recently moved her to Atlanta to be with me. But in that, all that time, I had been struggling with just dealing with it on my own and needed to find a support group that was going to help me just kind of process through everything that I was going through. And even though there were tons of groups around, I just didn't feel that sense of belonging. And so I was searching online, I found HFC, and HFC, I was looking for a while, and we were trying to make that connection, and it came together, found a group. And I am with a group of women that just basically a family at this point. We have not, I mean, we're just in this, right? And just like,
That's so cool. That, I mean, there's your
we're just
tribe,
in
there's
it.
your people.
Yes, it's my people, it's my tribe. And it's really just helped me from a mental standpoint to be able to share and have conversations. I'm talking about, we cry, we laugh, I mean, like all of those emotions that you think you can share with other people, we actually get to share that even though we're not together and we're virtual. I mean, we really just have that thing going. And so it's been really a tremendous support. And I thank HFC for even forming anything like this to really help us do this. And so I'm so grateful. I feel great because I have them that I get to connect with, twice a month, and know that if I need to reach out, I mean, they're going to be there kind of supporting. And so it's been great. It's been great. A lot of other things going on with mom. It's still happening, but I tell you, I'm all the better for it for this group. So
Amen. Amen. And Kelly, let's turn to you because I'm sure you could relate to all of that. You, like the rest of this panel, you've got a lot going. You have a very big life. In addition to caring for your mom, can we talk about that piece of prioritizing self-care? And if you're doing that, does it create a better situation for your mom?
Hi, well, first of all, thank you for having me. I'm so excited to be a part of this panel. As you mentioned, I'm the caregiver for my mom, and I do think it is so important to understand like what is going to be the best situation for you that would put you in the position to be the best caregiver for your parent. And I know there's a lot of decisions around that, as you mentioned, the like fog feeling when you're a caregiver. There's so many different things, so many different options, and there is a lot of guilt with a lot of decisions that you're going to make. And I just think the most important thing you can do, again, is find that what you're going to be the most comfortable with. They'll make you the best possible caregiver. So in the beginning, when I started this journey, and mine was somewhat similar to Rachel and Monique, I had no idea what was going on. I was suddenly thrown into like, you need to find some care for your mother. I was kind of the only one that was able to make those decisions for her, or the only one that I guess the family wanted me to make the decisions for her. So I was so confused, so overwhelmed. There's so many different options. I had really no idea where to turn to for help. And I think just through the process of finding different options, talking to different people, visiting a lot of different places, I found a place that I really love. It took a lot of work that I had no idea like this process of finding care would be this overwhelming. But after I was able to do that, I think the most important thing was that I found a place and found resources with people that I liked and trusted. And once I was at that point, being able to get to the next part where you have a group of people that are supporting that decision, I think is the most important thing. Because as you mentioned, and we've talked about this in our HFC care group, it's just there's a lot of guilt. And I always have said, if you put your loved one in care, it's going to feel like it was too early, and it's going to feel like it was too late. No matter what, you're going to be.
No matter what, that's right.
Yeah, you're going to be stuck in this in between. So having the people around you that are going to support you and say like you made the right decision for you and for your loved one is so important. And that's why I love the women in HFC, my care group. Monique and Rachel and I are all in the same care group, and it's just so wonderful to have people that understand where you are and can say, you're making the right decisions for you and for your loved one, because you're going to show up as the best possible caregiver if you're happy and you're feeling like they're safe and you're feeling like it's a good decision. But again, it can be hard. It can be hard to think like what other people are thinking, and especially if they're not in the same position. So having people that support you, it means everything. And even just when you're in that role of caring for your parent or loved one. So I go visit somewhat regularly. Obviously, coronavirus has, impacted that, but I always feel like if I don't visit, I feel terrible about it. But it's really, really hard to visit. Like it's not the same person that you knew, and it's a different kind of connection. So it's just a balance of finding like, I'm going to be upset, but I'm going to feel guilty if I don't go. So it's just this like balance. And I think that again, those people that can say it's okay to strike that balance and it's okay to not feel guilty when you're not there. And it's okay to, it's going to be hard when you are there, and that's all going to be okay. So
my mother used to say to me, show up, do your best, let go of the rest. It's that letting go of the rest piece that's so hard. But what all of you have said about your groups is, that you're getting validation that you're doing your best. You're getting a reminder. Your teammates there are holding up a mirror saying, look, you're trying, and that's all you can do is really try your best. Dr. Kadak, I want to go to you and talk a little bit about what they've all been saying, which is, caregivers move forward. That's what we do. We put on a brave face, we carry on. But can you discuss some of the physical and the emotional effects of caring and what we should look out for?
Thank you for asking that. I think one thing I want to say, Leeza, is that everybody on the panel just mentioned about the suddenness of, the caregiver. I remember a quote I had read that, we take so much time to prepare for motherhood, and it's like years, and then it takes 9 months to be a mother and 9 minutes to become a caregiver. And that's what I had experienced when I used to get my calls long distance. So coming back to some of the warning signs, I think that when you are suddenly thrown in the throes of caregiving and there's everything to be taken care of, like planning the care or the doctor's visits or even the specifics of diagnostics, I think we just sometimes stop breathing. And, the signs are typically fatigue and being overwhelmed and losing focus and trying to manage so many aspects. I mean, all these beautiful people on the panel right now, you're managing your own lives, your own health, your own families, and then you have a parent to take care of. So I think it's very important to know when you start this journey that there are physical symptoms, there are psychological symptoms, and there are mental health symptoms. It's been written about in every research journal, and we need to be aware of it. So unless you step back and say, am I taking care of myself? And I know it's so hard to do. It's so hard not to feel guilty. So if there is direct evidence, which is evidence-based research that shows heart disease, respiratory illness, chronic fatigue, then just depression, all of these are side effects of caregivers. And one of the things, Leeza, we're trying to lobby for is for primary care doctors, when you do go and make a visit, you ask them, are you a caregiver? Are you experiencing any of these? And then help guiding them, because caregivers do not stop. They are just constantly working. So those are the signs, and we have seen so much of evidence of physical and mental correlates of caregiving. And this is becoming much more with dementia because there is an unpredictability of the disease. We don't know what stage they are in, what's going to happen, how much losses are going to occur. So it's a complicated situation.
You mentioned the depression, and Carlos, you had said that was one of the things that you experienced. I think it's the loneliness, sadness, depression, those feelings are very common companions to the caring journey. And then you moved back home, I believe, to take care of your dad, which I would assume many people joining us right now can relate to the role shifting and triggering a lot of childhood trauma, the relationship changes. Can you tell us how you dealt with that? Because I think it was very resourceful that you used the arts.
Well, that's a good question. How I guess coped with it was just kind of, being engaged with it and finding avenues and an approach to being the best friend to my dad. And I don't know, just really overcoming those traumas. I'm overcoming them right now. I mean, today, my dad said something about my driving when I was driving him to his girlfriend's house. But it's like those things I have to suppress. I have to kind of bury them and put on a happy face and say, yeah, Dad, I'm a horrible driver. Who taught me how to drive? And it was him. But I have to kind of be creative in my own self-care.
And not trying to talk him out of the feeling that you're a horrible driver. That's right. The thing that we have to remind ourselves, right? That we have to join them in their disease because they can't participate at that level with us. And of course, now the disease is harder. The pandemic has made a bad situation nearly impossible, I think, for caregivers, for millions of caregivers. I mean, look, they're worried about getting sick. They're worried about their loved ones getting sick. A lot of services have been cut off. And in a report that you guys may have seen that came out just this week, most say they're experiencing a very dramatic increase in stress, like up 80% and more. So, Dr. Olson, can we talk about what can be done, what is being done to combat this COVID-19 isolation and social distancing pressures on caregivers?
I think that's where HFC is really shining. The groups that they have created, support groups, are critical. We and some other organizations have one-on-one coaching. Much like the groups, it's someone to talk through the problems or just to sit with and cry. I think the other thing that we see now is to think about who are the people that are caring for caregivers, and how can we engage them in the conversation. I often think about when somebody tells you to go to the having a baby analogy, when somebody says that they're having a child, you bring over maybe some casserole or something, you bring gifts. When somebody tells you that they're in a caregiving role or that someone they love has been diagnosed with Alzheimer's, there's kind of a slow step back from that person.
Sometimes
so I
it's a run to the exit, right?
It is, because you don't know what to say or what to do. There's no like Hallmark card, casserole to bake kind of experience. And so I actually think that the onus has to be on people who are not caregivers to stand in that space and just stay connected to caregivers. Maybe it is to just put a casserole on the front door, or to leave a note, or to send a text, or just to be there with somebody and not have expectations. But I think one of the biggest challenges is to not think that caregivers need another thing they need to do. Do they need to find a group? Do they need to find a coach program? If you're not a caregiver, right, and you're a caregiver, maybe you're on this call because you know somebody in your life who's a caregiver. What can you do to be supportive of them? And I think all of the people that we work with, I think of caregivers as some of the most altruistic. Every caregiver we work with is eager to help other caregivers not go through the same journey. And so I think the caregiver peer network is an amazing network in every community.
Let's throw that out to our caregivers then. What should people be doing to be helpful? What was the first thing that somebody did where you went, oh, thank God somebody offered you X? What was it? Rachel, you first.
I think for me, being so young and being fresh out of college, my friends were still very close to me. So, I was really fortunate that when I went through a period of, darkness, being busy, whatever, that some of my friends reached out to me and said, hey, I haven't heard from you in a week. Are you okay? Where are you? What's going on? Like, how are you doing? And just knowing that someone is thinking about you, I think is a really special thing, because you're constantly thinking about someone else. So
when you could say to them, Rachel, that you're not okay, and they can receive that and not necessarily try to talk you out of it.
Absolutely. Absolutely. Yeah. I think finding people that you can be open with is so important, because joining the support groups is great, but your support group, it's at a special time, and it's a special part of your day you're setting aside, but what about the rest of your day? What about the rest of your week? And I think being able to confide in people is really special and really helpful. Yeah.
What's a great way to help, Monique?
I would say, so in my situation, I spent all of my young years in Lakeland, Florida, and mom was living there forever. And so while I was here in Atlanta, she was going through what she was going through. What I needed was help from someone in Lakeland, which we had a few people who would just go and check in on mom for me and everything. And so that was really, really, really helpful. So if someone came to me and said, Monique, I'd support, especially in situations where you're away from the person. And there's a lot of that going on right now with caregivers, that they're not in the same place and they're having to find resources and help. And so if somebody would have just said, Monique, I'm going to go check on your mom at least twice a week, make sure that she's eating or whatever, I mean, that would have been a tremendous help. So I had a little bit of that, which was helpful, but then I realized that she needed more, and then I had to move, and then I moved back to Lakeland, and then eventually moved her back to Atlanta.
I think Dr. Olson may have been saying the one thing that caregivers don't need is to figure out what they need. So when someone says, well, let me know how I can help you, it takes a different skill set and a different kind of switch in our brains to be able to say, yeah, could you come pick up the laundry? Could you sit with mom for an hour? But oftentimes those are kind of those empty asks, like, let me know if you need anything. You really do need stuff, but wouldn't it be great for somebody to come forward and say, how about if right? How about if I did this? I know this group would agree that as far as caregiving in general, we are getting much better about having a national dialogue about it, but not having enough real conversations in boardrooms, not enough support at the state level, the federal level. Maybe Dr. Olson, Dr. Katak, this is good for you to talk about what's being done to sort of improve these support mechanisms for caregivers. Dr. Olson, you want to go first?
Sure. I think a lot of it is awareness, right? That that boardroom conversation, companies and employers talking about caregiving needs to happen, obviously, and legislative opportunities in government are there. I think a lot about smoking as an example, and how to reduce smoking, there were policies put in place, fines from your insurance company sometimes, helplines, commercials, some gross and some funny, and all of that had to happen together. Workplaces, legislators, health departments all had to work together to reduce that smoking rate. I think caregiving needs that same type of approach, right? Employers need to think about approaches to supporting their employees, pharmacists, who are some of the first people that meet caregivers, because that first thing a lot of people do is pick up medication, right? How can they be part of a solution? How can dentists be part of a solution? A lot of people skip dentist appointments as one of the first things they skip in taking care of themselves as a caregiver. What are those, where are those places where we are kind of building a more supportive environment so that we're not depending on the caregiver to do the self-identification? I think that all has to happen, and it has to happen kind of at every level, kind of caregiving in every conversation in some ways. Every time we think about everything from tax policy to leave policy, where is caregiving in that discussion?
Where is caregiving in those discussions? Really, really great. Dr. Katak, do you want to add on to that?
I think everything Dr. Olson said is just absolutely right on. I think you really need to start the dialogue. I think it has started because we are seeing more and more hospital systems and healthcare systems take note, but it really has to be a national impetus, because you have to realize that older adults, especially with dementia patients, we don't have a lot of resources available to them other than adult day health programs, some of the county programs. So we need to make this a national dialogue. How do you take care of the caregiver that is taking care of somebody that is likely to become very disabled? And with dementia patients, there's a whole lot of other incapacities. So I think it's starting, but we need to do a lot more. We need to focus on this just like you said, like the smoking campaign, but it has to be, as I say, relentless, and it has to be constant.
I'm assuming there are a lot of people joining us who maybe are in their beginning steps of the journey. Or no matter where we are with this, it's always kind of good to get that look back. So can the support group members answer for me, if you were speaking to yourself however many years ago when you first had those 9 minutes, as you said, that you realized, oh my gosh, now what? What do you wish you would have said to yourself? Kelly, start for us. What do you wish you would have known? What do you wish you could say to that person now to make it better?
Well, I think the thing I would say, if I could go back in time, is to just be very, I guess, like gentle with yourself. I think that it's so important. You have a tendency to be very hard on yourself in the process of finding care for your loved one. And also to accept help. That was really, really difficult for me in the beginning. I felt like I had to do everything. I felt like I had to be me that made the choices, and like made the hard decisions. I again, I think that part of that was that I was the one, like, I guess, accepting that role for my family. But as we just talked about, like, at what you can do for caregivers, a lot of my friends were offering to do things. And I think specifically one of the things that was the most helpful to offer was I had a friend who was like, I will go visit places with you. And it is so hard to make the decision of what place to put your, to like have your loved one. And it's hard to be objective. And so I think if I would have accepted sooner someone going with me and seeing places, it would have been a much easier process for me, and like more, I'd be able to more accept that whole process in general. So if you're wanting to help someone, I would say like offering to do that was such a big deal for me. And then also, I think other than that, there are a lot of resources online. I didn't know about them at the time, but I think there's so much stuff that you can find. I mean, we've talked about a lot of those resources today. I literally started not knowing the difference between assisted living and independent living and, you know, Alzheimer's care and, you know, any of it. I had no idea what Medicare or Medicaid would cover. And it's also convoluted and confusing. And I think finding those resources early and then accepting help would be the two things I would say most helpful.
I love that you mentioned having somebody else not only witness what you were doing and what you were going through, but physically being there. Because I think sometimes when we're overwhelmed or when we're in grief and when we're in that state of shock, we can't even access what we know in our brains, right? So because we do have that fog. So to have another set of eyes and ears and somebody just be there in the physical space with you is really nice. You mentioned receiving help. We have a mantra at Leeza's Care Connection that is breathe, believe, receive. And of those things, receiving tends to be a really hard one for caregivers. Can anybody relate to that? Carlos, did you have a hard time receiving help? There's that whole big platform going on now, Man Enough to Care, which is a beautiful campaign that's happening, focusing on men like you who are caregivers, who do experience it differently. It's 2/3 women who are caregivers about, and 2/3 of the brains being diagnosed are women's brains. Did you find it different? Did your gender make a difference in you getting help and being able to receive help?
Yeah, I think so. I mean, you know, my dad has a stigma about his diagnosis, and it kind of like overlaps to me. I have a stigma of being a caregiver. When I first started, I told people I was supervising my dad's health. And, you know, I was actually a caregiver. I was a full-blown caregiver, and getting that help was kind of, I was resistant to it. You know, it's like, why do I need help? It's just my dad. I can take care of him.
I'm just the son, I'm just the daughter. We hear that a lot, right? I'm just doing what I'm supposed to do. But somebody mentioned earlier, you were the one, the designated person. There's always one, it seems, who either wears the badge, they put it on themselves, or it's put on them by others in the family. Do you, Dr. Olson, in your work, do you hear a lot of kind of family resentment, those family dynamics of trying to deal with someone in a caring situation?
I chuckle because I think family challenges are one of the most common elements of every kind of caregiver story that we hear at some point, either early in that kind of designation phase or when decisions are getting tough, or people who, you know, think they have different rights around those decisions. And that's constantly a source of stress. Again, that's another amazing caregiver skill. They're really good at mediating family drama, whether they want to admit that in the moment or not. It's an amazing skill that caregivers end up either having or having to build because of those dynamics.
And kind of recognizing that the other family members may have different limits. You know, I'm the middle child. I have a big brother and a younger sister. So I was that person used to kind of mediating and being the peacemaker. But recognizing what my brother brought to the table, what my sister brought to the table were very different skills than what I could bring to the table. They were hands-on, frontline. I was the longer distance. And Monique, you can relate to that because you kind of had that scenario in your family as well. Were you sensitive to criticism from the outside world? Did you feel that people kind of getting in there talking about how you were doing it was really upsetting you?
Well, I don't know if it was upsetting me as much as I just really couldn't believe that people were even having an opinion about how I was doing this, because no one was
Right.
helping.
But
So
they do.
yeah, I was like, really? Like, I mean, are you writing the checks in here? Like, are you, I mean, it was just, it just really got crazy. So I, yeah, I didn't really, I just decided not to pay any of that any attention as I moved through, and I made the decisions on my own. My sister was there, but she didn't have any dealings. She didn't want to have any dealings, obviously. I mean, she's involved, she cares, but her interaction with this is just very different. And so, yeah, I mean, yeah, I just totally didn't allow them to egg me on in any kind of way, because I knew I had to do it. And I pretty much was doing it on my own. And so as the part of like receiving help too, that was, I wanted help. I just didn't have too many people offering. So that was the difference between, you know, someone saying I want to help and you not wanting it. I mean, I would have taken anything that I could get. And so it was difficult. So
Yeah, I always talk about the kind of gold star. We feel like, there's a place in heaven for caregivers to do it all themselves. We're going to
yeah,
I
right.
wanna get that gold star, man.
Yeah, I don't want the gold star.
Yeah, you were saying, I'll give it up.
Yeah, I don't want the gold star. Okay. Listen. Yeah, there's a lot of that going on too, with, just people saying, oh, Monique, you're going to be blessed. And I was like, I'm just doing what I am supposed to do. I mean, like I would do this. So, I mean, I don't necessarily want to be blessed by it. It's just, I'm doing it. This is what you're supposed to do. Right. And so it's been interesting. So
But aren't you amazed? I remember at certain points feeling like, oh my gosh, I am able to, feeling proud, and then feeling like maybe I shouldn't be proud because really I'm just fulfilling my responsibility. You know that quote about caregiving calls upon you to kind of lean into love that you didn't think was possible. What were the things that you just didn't think were possible that you actually managed to pull off?
God.
I mean, anybody jump in on that? We've had those moments, right?
Yeah, yeah.
Where you go, damn, I'm good.
Yeah, yeah, they were crazy. Like I could not believe that I would even move back to Florida from Atlanta, just totally make that decision, move my whole life and just make a decision to just be there for however long I was going to be doing, and then move mom back. And all of this happened in a span of like 6 months. I sold her house there, brought her back, got all, I mean, it was crazy, guys. Like it was crazy. I'll let, Rachel or Kelly chime in on theirs, but I
You
don't,
did everything.
yeah, I was like, I don't want anybody patting me on the back for any of that, because it was crazy. Okay. I did it. I'm happy I did it, but I wouldn't put that on anybody ever,
It changes you. And I know they're going to be wrapping us up with time, so I want to be sensitive to everybody joining, and certainly this incredible panel. Are there final thoughts that you just really need to say to these people that are watching you right now, that are depending on you for what your insights are? Anything that we really can't wrap up without saying?
I would just like to encourage anyone who has the means to seek out individual therapy as well as group therapy. I think it's a really important thing if you're able to get that one-on-one attention. There's just so many deep things that you can deal with in a one-on-one situation that, maybe you can't quite get into with a group. And I think that was actually something that really helped me, especially kind of, it is the long goodbye. And I was in a unique situation where, because my dad died, I grieved for that death, but then I, sort of lost my mom in this slow way. And being able to have that one-on-one therapy helped me to also grieve her loss. And it really kind of helped my emotional health in a way that I didn't realize I needed. So I just would really encourage anyone to do that if they can.
It's a great tip. All of you have had such great tips, great advice. This has been tremendously valuable to me as well. I hope everyone joining us has learned from this incredible panel. The folks at HFC are there to support you, to educate you, to provide you with resources. We try to do the same thing at Leeza's Care Connection, but the point is, like you were just saying, the point is reach out, get connected so you can feel more confident, you can be more competent on your caregiver's journey. So thanks to each of you, thanks to everybody joining us, and thanks especially to Seth and Lauren for this incredible opportunity. Congratulations, the first CareCon.